My podcast. Today I'm going to talk about anorexia nervosa. So, in this station, basically, you will see a young teenage girl who's obsessed with her body weight. She feared the excess weight. She starved herself and all the time look in the mirror. And she wouldn't admit the problem at all. Those cases, usually their BMI is less than 17, and you have to be careful and taking history and understanding the underlying issue. So basically, you will start by introducing yourself, double checking with the patient name, date of birth, and then you will start to let the teenage open up with you. So patient want to look always good and always they are emotionally unstable. So you will start by what brought you to the hospital today. If she was with her parent, you will try to inquire and try to speak to the teenage on her own if that's helpful for her. You need also to ask the parent if they have any thought in their mind about the issue. So they might tell you that their teenage is losing weight and they're not quite sure what's going on. Usually, such teenage they have their own peers and their own friends who likes to look good, and maybe they have a role model that they want to follow. So they starve themselves very extremely, and they do a lot of exercise. It could be reaching to 2 hours per day sometimes, and intend to not eat, or if they eat, they will try to purge, so by inducing vomiting in order to lose what they have eaten already by vomiting. So you could start by asking her what's her eating style. So what she takes for breakfast, for instance, lunch, dinner. Ask her about her exercise routine. Ask her if she feels any fatigue at all. If she's looking in the mirror as well all the time. If she's scaling herself and weighing her weight every day. So all of that you need to ask. Inquire also about her mood. How is her mood lately in a score from 1 to 10? So you need to ask all of that. Also ask her if she say, for instance, her mood was low. Tell her if she had ever thought about hurting herself or had put a note about planning something. All of that is very important to ask. Also, you need to ask her about her period. When did it start, menarche, and if it's regular, and if she's sexually active, and if she's taking any contraception at all, and if she, by any chance, that she could be pregnant. After ruling out all of that, you could send for some blood investigation. So you will tell that there is certain blood test I would love to send for. Are you happy for me to do so? If the patient is happy with everything, so you're gonna run all of that blood test, including full blood count, liver function test, erythrolyte, creatinine, thyroid function test, and urine test, and some of the minerals like magnesium, like sodium, potassium. And also, before doing this, you have to examine the patient, look for sign of anemia like dizziness, heart racing, lightness. Also look for any swollen lymph node. Look for the teeth. There is bad enamel, which would indicate regular vomiting. Look for thickening in the knuckle, which imply inducing vomiting. Look for her nails, for her hair. they are brittle or they are dry. And check her weight and height, and if BMI is low, lower than 17, you maybe need to admit the patient because it could be life risking. So after doing all of that, you need to arrange for talking therapy, CBT, which is cognitive behavioral therapy. And you need to involve parent as well. It could be a grouped one, which is called family behavioral therapy, to explore what's the difficulty and try to sort it by that session. And then if the patient seems to be difficult or if is not responding, you need to talk to your senior, and under the Mental Health Act, you could section her. So by that, I think I have covered most of the points about anorexia nervosa. It's one of the most important cases, which could show in lab 2 as well. So I hope by this I addressed some of them, few important points and brief, and I'll talk to you again in another episode. Thank you.